Footprints. One night I dreamed a dream. I was walking along the beach with my Lord. Across the dark sky flashed scenes from my life.
Oh, how sweet.
Footprints is our palliative care department for our hospital. We serve families and children of all ages. We strive to be an added level of support for these families, advocate for them when we need to, when they feel like they can't advocate for themselves.
When a child is diagnosed with a serious illness, we empower families to step back and take a look at the big picture of their family and their child's life and rediscover what a new normal will look like.
The core medical team manages the details medically for the patient, but Footprints is a layer on top of that management to make sure that the patient and family have all the time to truly understand the implications of this diagnosis and the ongoing management of the care of the patient for them as individuals as well as family members for the patient.
For each scene, I noticed two sets of footprints in the sand, one belonging to me and one to my Lord. I am Amazing Gracie's mom, and we were diagnosed at 6 months in utero that she had trisomy 18. In our 17 months with our sweet Gracie, we spent a lot of time coming back to Cardinal Glennon and would have short stays for a week or two. I do remember being in the NICU and Footprints coming in, introducing themselves, it was Kathy, and handing me her card, and she just sits down and says, "We're in this together." You know, is her basic message.
When the last scene of my life shot before me, I looked back at the footprints in the sand, and to my surprise, I noticed that many times along the path of my life, there was only one set of footprints. I had a 12-year-old who asked me if she was going to die. Usually kids will ask those questions when their parents aren't there because they're afraid. They're afraid of, making their parents upset or stressed or just lots of reasons.
Alec was diagnosed with osteosarcoma bone cancer in May of 2015, and we were referred to Cardinal Glennon by our pediatrician. Footprints is there to help you with the appointments, to help you with whatever direction needs to go next. It's really nice to have that base of, it's not just a nurse, not just a doctor, it's not just a social worker. It's more like that personal relationship that you get with them.
It's a really cool program that they just help you, and like what questions you can ask, that they're going to be answered and that they can answer them and tell you that you're going to be all right and all that.
I realized this was at the lowest and saddest times of my life. This always bothered me, and I questioned the Lord about my dilemma.
It was Gracie's time to go. And hearing those words as a parent, knowing that she's given so much fight and that you've been there through that whole fight, and knowing that you're coming to the end. Kathy was there to hold my hand. She handed me every tissue out of an entire box of tissues, and whatever you need. She was just there to catch me and to just be there in, whatever level of support that she could give me at that point.
Lord, you told me when I decided to follow you, you would walk and talk with me all the way. But I'm aware that during the most troublesome times of my life, there is only one set of footprints.
Footprints is seeing 2 to 3 times the volume that comparable pediatric palliative care programs are seeing around the country. The sheer volume of patients that we're consulted to see and the acuity of illness of those patients is really demanding from a staffing standpoint.
Right now, it seems like we're running and putting out fires. We're trying to get the people that are really having big, huge issues. But then at the same time, there's families that, I'll stop by and I'll say, "Hey, how are you doing today?" And, I want to be able to have those bigger conversations because they need them.
You want to have more people, like many of people, standing there and having your back right there.
I just don't understand why, when I needed you most, you leave me.
I think most people in pediatrics would agree that supporting a child's emotional and psychological and developmental health is just as important as their physical health.
The team has an opportunity to meet a family at their most vulnerable times and give them guidance and direction and support for their decisions that they need to make.
It's just that reassurance that you're truly cared for, not just as a patient, but as a person. And Footprints really goes above and beyond to make that happen.
it's cool. It just makes me feel like good that I know that they're there and that they can help.
They need that help and guidance to get them through, and their families do. It's stressful, it's time-consuming, it's exhausting, and they need someone to walk that with them.
He whispered, "My precious child, I love you and will never leave you, never, ever. During your trials and testings, when you saw only one set of footprints, it was then that I carried you."